Coronavirus continues to develop and spread around the world, although there are some signs of hope, which we're going to get to. Now, you should know, before we get to the hope, that it has now spread to every continent except Antarctica. We'll see if that ends up happening. It's infected nearly 90,000 people and killed more than 3,000. So that number does continue to go up. It is currently lower than some of the other pandemics that we've seen. Ebola back in 2014 killed more people internationally, but this is spreading, so we will have to see. Now, in the United States, on Friday, there were 65 cases and no known deaths here in the US. Now, tragically, over the course of the weekend, a single hospital in Washington State reported 2 deaths, the makings of a cluster there, and the total number of cases nationwide jumped 35% to 88. Now, as you might have seen, both of the individuals who died at that Washington hospital did have underlying health issues that are believed to exacerbate coronavirus if it is found. We know that certain demographics are far more likely, tragically, to die if they contract the virus than younger, more healthier individuals. But we entered the weekend with no one having died, and we unfortunately did not leave the weekend in that same way. And so perhaps this is where it will end, but we do have to be ready for the possibility that that will not be the case. Now, let's zoom out. Worldwide situation of coronavirus. You can see a map here that's being constantly updated by the New York Times. And you can see there that we have the 88 cases now in the US, significant percentage in Canada, 22, especially considering their far larger population there. But it is throughout the hemisphere, in Mexico and in Brazil, some other countries there in South America as well. And then on through Europe, Middle East, and Asia as well. Some very large clusters of cases too. For instance, Italy, which now has more than 1,600 confirmed cases. Iran, 1,500 with 66 deaths. Travelers from both countries appear to have spread the virus to other nations in the Middle East and Europe. Elsewhere, Indonesia, one of the few large nations thought to be free of the virus, said today that it had 2 confirmed cases, while others were reported from Australia to India to Portugal. And so there is bad news. The first deaths in the United States, explosions of cases in Italy and Iran, and some countries that had been free through several months of the spread of the disease internationally, now having their first cases. And some of the countries that already were pretty hard hit by the disease, the numbers are still fairly large, or very large, I should say. South Korea has 599 new cases, bringing its total to over 4,300 with 22 deaths. In China, the number of new cases was 202, bringing its total to over 80,000, including over 2,900 deaths. Now, it's difficult to see how any of that can be considered good news, but you have probably heard the beginnings of the people almost don't want to say it out loud, but the possibility that in China that the rapid expansion of new cases has slowed. And so only a few hundred new cases being reported over the past couple of days is actually considered a great deal of progress there in China, where in some cases in a 24-hour period, you had an explosion of many thousands of cases. That might be ending. But of course, until we're free of the disease entirely, we can't say for sure. We don't have necessarily the most sophisticated treatments possible like we do for some other diseases, and we certainly don't have a vaccine. And so we very much are not out of the danger zone there, but at least in China, by far the hardest hit country, there is some good news potentially. We will see in the United States, it's possible that those 2 deaths will be the last. But we do also know that some areas, even in the United States, are now seeing the spread. New York reported its first case in Manhattan over the weekend, and hopefully isolated. But the fear would be in a place as densely populated as Manhattan, as New York City, that they've gotten that person, but people might not yet have manifested symptoms. So we will have to see, obviously, fingers crossed that is not the case. Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.